Women going through menopause face special challenges and could greatly benefit from the care of a certified nurse midwife. Erin, it is always great to see you, and let's remind everybody, you are a certified nurse midwife, so explain again what you do.
So certified nurse midwives are specially trained after receiving a bachelor's in nursing and then going to a master's degree program to care for women throughout the lifespan. So from puberty through adulthood, pregnancy and birth, and then through the perimenopausal and menopausal transition.
All right, so care for women through their entire lifespan. Let's talk about menopause, though. What would you say is the typical age that a woman starts menopause?
The average age to go through menopause in the United States is 51. You look at that, and that perimenopausal period can be actually a lot longer. Some women experience symptoms for 7 to 10 years before actually reaching menopause. So you can be looking at women in their early to mid 40s already experiencing some menopausal, perimenopausal symptoms.
Okay, and then urinary incontinence. I hear that's also a female issue. How do you address that?
Yeah, it's a thing that a lot of women report, especially after having children, that they leak urine when they cough, they laugh, they sneeze. A lot of women joke about it with each other and talk about it, and they think it's their new post-birth normal. And a lot of times there are things we can do to improve that or eliminate that altogether. And we usually start with exercises and physical therapy. If that's not working, there are medical devices we can place and fit in the office. And then of course, if that's still not achieving your goal, we have OBGYNs we collaboratively work with who we can refer you to for surgical intervention and options as well.
And Erin, I also hear too that menopause can cause some challenges in the bedroom, especially in the way of relationships.
Yeah, women will often come in menopause, perimenopause, reporting vaginal dryness and irritation, which then is causing painful intercourse. And a lot of women think this is my new menopausal normal. There actually are a lot of things we can do to improve those symptoms in kind of a stepwise medication fashion to make things better and improve those symptoms of pain and irritation and improve relationships with their partners.
And two, I've also heard that reoccurring infections can also be something else that occurs.
Yeah, and that comes in the form of either vaginal infections or urinary tract infections. And we see increases in those as the hormonal transition occurs and there's changes to that area and the tissue there. Of course, we're going to treat the causative organism, but we look at it in a bigger picture of what's the root cause of this happening? Why is it recurring? We look to diet, we look to different treatments that we can offer to improve that tissue in that area to kind of prevent that recurrence from happening.
You know, the very specific focus on women's health is just such a breath of fresh air, Erin, and I know so many women are probably feeling their shoulders lighten knowing that there is someone out there like you that can help them with these challenges. Where can we go to learn more?
If you go to saltzerhealth.com, you can find more information.